Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com, or you can get hold of me, Jason at intricateartseminars.com. Today I just wanted to talk to everybody about swelling, right? So there's a couple of types of swelling. There's regular joint swelling, which is like the visible swelling that we can see, and then there's joint effusion. So effusion is just swelling inside of the joint capsule itself, right? So effusion, unless it's extremely bad, may not be visible. Regular edema or swelling is going to be the visible joint puffiness that you see. Okay. Why do joints get swollen? The reason that joints get swollen, or that tissues get swollen, because the things that get swollen have vascular tissue in them, right? Like bone lining or muscles or tendons. So the reason that things get swollen is our body's natural response to any type of trauma. So let's talk about ankles, because ankles is probably one of the most common things that people do to themselves that get swollen. So you sprain your ankle gets swollen. Well, why is it getting swollen? The reason that an ankle gets swollen after you injure it is because the body's natural response to trauma is to tighten everything up in the area to avoid immediate further injury. It's just the way that the human body has developed through evolution. We haven't typically been in a safe space when we've been getting injured, like we may be out in the jungle or being attacked by a tiger or something like that. So up until very recently, when humans were injured, typically it was a pretty big issue regarding whether you were going to be able to survive the next day or so. Nowadays, we don't really have that problem, at least in the United States. So we need to start looking at medicine differently, and swelling is one of them. So why do joints get swollen after you sprain them like an ankle? The reason is that when we get injured, our sympathetic hyperactivity goes up. So remember, our autonomic nervous system needs to be like a seesaw with parasympathetic on one side, sympathetic on the other side, and it kind of balances back and forth throughout different parts of the day, right? So the parasympathetics are more of, like a lot of people say, the rest and digest part of the autonomic nervous system. Those should be on more when we're sleeping. The sympathetics are a fight or flight response. Those are on more when we're playing sports or when we're injured. So almost all human mental and physical stress, strain, and trauma causes sympathetic hyperactivity. So one of the most common things that happens when our sympathetics goes up is our blood pressure goes up, our heart rate goes up, and the arteries get constricted, because sympathetic hyperactivity is a distal vasoconstrictor of arteries. So now we have tighter arteries, we have more heart rate, we have stronger heartbeats, more blood ejection volume, and we get a lot of extra blood initially going to the area of injury, so going to the ankle, right? Let's just take gravity, and I may talk about gravity a little bit, but obviously if you're standing up, gravity is going to play a part in ankle swelling. And you can always use gravity to help eliminate swelling. So, however, the way that the vast majority of people treat swelling is ice, compression, elevation, right, and immobilization. A lot of people learn like the RICE or PRICE acronym in school. So, okay, so we have to think about, well, why are we doing that? Well, we're trying to get rid of the swelling. That's what that whole process is for, okay? But the way that addresses swelling, the way that ice addresses swelling, is actually inhibitory to healing, and it really doesn't make any physiologic sense. So why do we have visible swelling? Well, we talked about that there's a lot more blood going through the arteries, the muscles are tight, blood pressure's up. So it's a physics problem with the flow of blood. So when our muscles get tight, arteries are really sturdy, they have strong walls because they have a single endothelial layer of smooth muscle. That's the contractile tissue inside the arteries, because they are under a lot more pressure than veins are. Veins have little valves, so if this is the inside of a vein in my ankle and the blood's going back up towards my heart, right, the way the blood goes back towards the heart is these little valves in the veins. The blood gets pushed up through the veins primarily via muscle contraction and relaxation. So when the muscles just lock down and get chronically tight, they stop contracting and relaxing and they just stay contracted. So what that does is that opens and it defaults some of the valves and the veins, so now blood can go up, but it can also go back. So typically blood goes through the valve opens, and then the valve closes, so the blood can't go backwards. When you have extra tight muscles and sympathetic hyperactivity, the vein valves get dysfunctional. It's one of the reasons that people have problems with erectile dysfunction as well, very, very similar. So the problem is not that there's not enough blood. The problem is there's not enough blood coming back through the area of injury. So the arterial blood is going towards the ankle, all the muscles are compressed, and we have much less blood coming back through the veins back towards the heart. Okay, so why does ice help improve swelling? Well, ice is a vasoconstrictor and a muscle tightener. So what ice is doing as far as swelling goes is ice is further constricting the vessels, just the superficial vessels, mind you, not the deep vessels. Ice is constricting the superficial vessels, and it's making the muscles tighter, right? So you may be thinking, well, didn't I just say that muscle tightness was one of the problems? Yes, that's why ice is not that great of a tool to use. Dry needling is much better. So by doing ice, you are actually maximizing the inflammation in that area overall, because you're causing the same response that is causing the inflammation in the first place, which is sympathetic hyperactivity, right? Ice elevates sympathetic. So the reason that we're using ice is to try to get the body to heal itself. We're not externally healing the body with ice and decompression and elevation. We're allowing the body to heal itself. So what is stopping the body from healing itself? A malfunction, a backflow of blood in the ankle. That blood gets old and sticky and stagnant and thick, and all the nutrients get used up in it. Muscles and tissues become hypoxic. Carbon dioxide goes up. The tissues get more acidic. Enzymes start to defunction. All sorts of problems start to happen, right? So what we want to do is think about, well, why is it swollen? A lot of blood going towards the ankle, really tight muscles that are restricting the veins, right? And not enough blood coming back through the ankle. Ice does nothing for that except alleviate superficial swelling, visible swelling. It's not doing anything for the inside of the joint. It's not doing anything for the deep tissues, and it's acting in contra to what we want the nervous system to do. So the maximal, fastest, best, most homeostatic way to get rid of swelling is to directly address the reason that the swelling is happening in the first place, which is tight muscles. Ice makes muscles tighter. I can tell you this from personal clinical experience for the last 10 years and from hundreds of people that I've taught. Once they start using dry needling instead of ice for swollen ankles, the recovery time and return to playing or return to just regular function is dramatically improved. So I just had a talk with the Missouri State Athletic Training Department, and we were talking about this, and the head of their program brought up some really cool pictures, and he was showing that after he took our class and started utilizing our techniques with dry needling rather than ice, he was getting players back to playing sports within a couple of days where it would have taken weeks prior. And the reason is that dry needling, if done properly, is directly addressing the reason that the swelling is happening in the first place. Ice is just like a lot of pharmaceutical drugs. It doesn't fix the problem. It doesn't even address the reason that the problem is happening. It makes you temporarily feel better so people think it's working well, right? Ice is not doing anything good to your nervous system in terms of swelling goes. What you want to do, although it may visibly reduce swelling, it doesn't address the reason that the swelling is happening, so the swelling overall is going to be much longer lasting. If you go in with needles and you specifically stimulate the parasympathetic portion of the autonomic nervous system, so those three areas would be the ear, the vagus nerve auricular distribution in the ear, the upper cervical spine because of the vagus and the trigeminal nerves, and the sacral plexus because of the parasympathetic dominance of that portion. If you add those treatments in alone to any type of swelling anywhere in the body simply by stimulating the parasympathetics which is going to reduce sympathetic hyperactivity, bring the autonomic nervous system towards homeostasis, and allow the body to heal itself better. Simply by targeting the parasympathetics, whether there's swelling in those specific areas or not, you will decrease body-wide inflammation. This is an indisputable fact that we know about dry needling, right? It reduces body-wide pro-inflammatory markers like the interleukin-1, interleukin-6, tumor necrosis factor alpha. Dry needling, especially targeting the parasympathetics, also turns on an anti-inflammatory pathway inside the cell, which uses the mitochondria to reduce intracellular inflammation and help cellular cleanup. It's called the NRF2 pathway. This is a very strong anti-inflammatory pathway. There's some really good acupuncture research looking at this pathway. So by specifically addressing the autonomic nervous system, by depressing sympathetics and elevating parasympathetics, and by directly targeting the aggravated tissues in the ankle, you can reduce ankle swelling in extremely short order and get people back to function or playing a sport or whatever they need to do with their ankle. It is a much faster, much better way to address swelling, because needling in this order or in this manner, by addressing the tight tissues themselves and by addressing specifically what's going on with the nervous system, which is we want to depress sympathetic hyperactivity, elevate parasympathetic hyperactivity to get the nervous system towards homeostasis so the body can heal itself. The big problem with one of the big problems with medicine nowadays is that so many people think about medicine in the reverse order. They're thinking, how can we fix the body, not how can we help the body fix itself. That is a key delineation in thought in medicine. And if you think about how we can help the body, or how we can facilitate the mind and the body to heal themselves and each other rather than externally forcing healing on it, we're going to do much better. So again, ice actually amplifies the reason that the swelling is happening in the first place. Although, again, ice may visibly reduce swelling superficially, it's not touching anything deep down in the body, so you're going to remain with that joint effusion, the intracapsular swelling, and the deep down swelling of the tissues. By needling the tissues themselves that are tight, number one, it's a direct treatment. We can needle right down to the periosteum, which is a very, very important thing to needle. Inflammation of the periosteum or periostitis is a very, very problematic thing in lots of chronic conditions like ankle sprains, because you strain the tendons, you strain the muscles, they pull on the periosteum itself gets inflamed, and you cannot treat periosteum without needles. It's the deepest tissue in our body that we can treat with dry needling. You cannot treat it without needles. So again, ice is not technically bad, it's just not a great way to get rid of swelling, because it's actually turning on the part of the nervous system that's responsible for the swelling being there in the first place, the sympathetics. Ice elevates sympathetics. To reduce the reason that swelling is happening, we want to reduce muscle tension, improve vascularity of the muscles, and improve venous and arterial blood flow, right? So over time, after the very, very acute cycle, sympathetic hyperactivity has detrimental effects on everything in the body, including blood flow. So again, icing for long periods of time for chronic swelling is not helping the cause. It may make you temporarily feel better. It's not addressing why the problem is happening in the first place. So if you directly address the ankle with needling and address the parasympathetic portion of the autonomic nervous system with the express intent goal of depressing sympathetics, elevating parasympathetics, normalizing microvascular vasodilation, which we know that needling does, normalizing muscle tissue length, which we know that needling does, and again, most importantly overall, needling has a very, very powerful effect on inducing autonomic nervous system homeostasis if you perform the treatment thoughtfully. Thanks. Let me know if anybody has any questions about anything.